Welcome. In this session we will talk about how to put the correct level of care postoperatively on your ambulatory surgery cases. So for the sake of demonstration, I have loaded the hernia post-op power plan just as a demonstration. And if you notice, the very first order here is pre-checked and is the level of care. Typically, a herniorrhaphy goes to an outpatient level of care, which is designated as ambulatory surgery. You want to be very cautious on the level of care when ordering postoperatively, because we are getting a lot of cases where the level of care is incorrect. And so to modify this level of care on any order set, you would make sure that first the order is selected, and then you would right click, and then you would use the modify option. And here, if you notice, there's an option for admit to inpatient, there's options for observation, ambulatory surgery, and extended ambulatory surgery. So I'm going to now briefly describe each one of these options, what is appropriate for a level of care. A typical outpatient surgery where the patient comes and leaves the same day and is expected to leave the same day, you would select ambulatory surgery as your level of care. A case that is typically an outpatient procedure that then requires additional supportive care due to pain or to the effects of nausea, effects of anesthesia, you would select extended amp surge, and then they would stay overnight. Okay. Along with that, you will need a bed request order, which is right here in the order set. You would just select that order and also place it. That's if the patient's staying overnight for monitoring and supportive care. Nothing bad has nothing has occurred that was ominous. And then the next level of care, higher than extended level of care, is this consideration for observation, which lasts for 48 hours only from the time that you place the order. And that observation is a period where you're watching the patient for a potentials of bad outcomes. So, meaning some bleeding, hypotension, hypoxia, uncontrolled pain. There are additional tests ordered, EKG, chest X-ray, additional consults ordered to elucidate something that you believe is happening to the patient. That's an observation. We don't know what's actually happening. We are adding additional tests and trying to figure out what is happening after the operation. And finally, a typical outpatient surgery that then goes to an inpatient level of care. That surgery requires more than 2 midnights of stay. It was an outpatient procedure. We know definitively, or we know pretty close to definitive what is happening, and their expected recovery period is going to be more than 2 days. 2, 3, 4 days, perhaps longer, because of an ominous outcome. Unexpected, unseen outcome. And so that is very important to know your level of care and to place the patient on the correct level of care. And so postoperatively, the admission status order is in every power plan, and you can right-click manipulate, right-click modify, and get to this order details screen. And once again, you can toggle up and toggle down using these black triangles to see the details screen. Okay, and so we want you to pick the right level of care right from the beginning. Thank you for listening, and thank you for paying attention to this matter.